Anatomists have divided the human body into regions. Some of the obvious ones are the head, neck, thorax, abdomen, pelvis, upper limb, and lower limb. The upper limb is divided into shoulder, arm, elbow, forearm, wrist, and hand. Based on the surface landmark, these regions are further divided to simplify the study of human anatomy. We will be discussing one of these regions today, known as the pectoral region. The pectoral region lies on the front of the chest. It essentially consists of structures that connect the upper limb to the anterolateral chest wall. The breast lies in this region. We have already talked about the bones of the upper limb in a previous video, so if you wish to go through the features of upper limb bones and their muscular attachments, we suggest watching that video first. The focus of our lecture today will be the contents of the pectoral region, which includes a detailed explanation of the muscular structures in this region. Before that, let's look at the surface anatomy of the pectoral region. What is surface anatomy? Surface anatomy, also called as superficial anatomy and visual anatomy, is the study of the external features of the body. We can say that surface anatomy deals with anatomical features that can be studied by sight, without dissection. Knowing the human surface anatomy is very important, as it serves as a basis for physical examination. The features that are specific to the pectoral region can be seen or felt on the surface of the body, as shown here. We will go through them one by one. First of all, we have the clavicle, which lies horizontally at the root of the neck, separating it from the front of the chest. We have already talked about the clavicular bone and how it is subcutaneous and therefore palpable throughout its length. Medially, it articulates with the sternum at the sternoclavicular joint and laterally with the acromion process at the acromioclavicular joint. Both the joints are palpable because of the upward projecting ends of the clavicle. Just where the clavicle ends, we have the jugular notch, also called interclavicular or suprasternal notch. It lies between the medial ends of the clavicles at the superior border of the manubrium sterni, as highlighted here. If we move downward, we find the sternal angle. It is felt as a transverse ridge about 5 centimeters below the jugular notch. It marks the manubriosternal joint. Laterally, on either side, the second costal cartilage joins the sternum at this level. The sternal angle thus serves as a landmark for the identification of the second rib. Other ribs can be identified by counting downwards from the second rib. This serves as a very important landmark when it comes to chest examinations. The nipple is markedly variable in position. In males and in immature females, it usually lies in the 4th intercostal space just medial to the midclavicular line. The epigastric fossa, or simply the pit of the stomach, is the depression in the infrasternal angle. The fossa overlies the xiphoid process and is bounded on each side by the 7th costal cartilage. It is situated at the apex of the costal margins. We mentioned the midclavicular line before. It is an imaginary line that passes vertically through the middle of the clavicle, the tip of the 9th costal cartilage, and the mid-inguinal point. The acromion process of the scapula is a flattened piece of bone that lies subcutaneously forming the top of the shoulder. The posterior end of its lateral border is called the acromial angle, where it is continuous with the lower lip of the crest of the spine of the scapula. The anterior end of its medial border articulates with the clavicle at the acromioclavicular joint. The tip of the coracoid process of the scapula lies 2 to 3 centimeters below the clavicle, overlapped by the anterior fibers of the deltoid. It can be felt on deep palpation just lateral to the infraclavicular fossa. The axilla is a pyramidal space between the arm and chest. When the arm is raised, that is, abducted, the floor of the axilla rises, the anterior and posterior folds stand out, and the space becomes more prominent. The head of the humerus can be felt by pressing the fingers upwards into the axilla. We will talk about the axillary region in much more detail in our upcoming video. That is all about the surface anatomy in the pectoral region. In the coming sections, we will talk about the muscles in this region, as well as the breast, which is a prominent anatomic structure in the pectoral region. So stay tuned.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.